Hi, this is Katie Owens with the Healthcare Experience Foundation. I want to share with you the first of a three-part series looking at the combination of patient-centered communication and behaviors in crisis. In partnership with the Maryland Healthcare Education Institute, our teams are looking to support you in managing and leading through this COVID-19 pandemic crisis. So we're going to cover two primary points across this three-part series. The first is recognizing the heightened need for perspective and empathy during crisis. And second, share with you our 5 CARES competencies to enhance patient-centered communication. So if you experienced any of these challenges in the last several weeks, you're all of a sudden now in situations that require new or significantly different communication skills. You're working to convey compassion with physical limitations. Maybe it's spatial barriers, PPE is an important barrier. You're not sure how to respond after a highly emotional, gut-wrenching event. You find yourself saying things that unintentionally heighten anxiety in your patients and their loved ones. And the pace of patient and family fears and anxieties are taking a toll on your team. It's creativity or judgment or frustration that's manifesting itself. If any of these things are the case, you are not alone. These are challenging times. What I want to do is share with you the importance of how we refocus ourselves and give you some tools to be successful. The reality is we have to handle communication with a degree of fragility. Why is that important, especially now? Communication misses jeopardize our relationships with patients and their loved ones. A harmful communication, despite our best intentions, activates our own defense mechanisms as well as those of our patients and their loved ones. And sometimes unintentionally, we do and say a lot without realizing our impact on others. This statistic to me really highlights the difference between our intent versus actual perceptions from a health system in North Carolina. 98% of physicians reported believing that they had addressed their patients' fears and anxieties. And unfortunately, only 46% of patients believe their physicians address their fears and anxieties. We know, and it is safe to say, that fear is at an all-time high. So while we might be doing our best and feel like we're doing a good job to address fears and anxieties, just a small snapshot of the things that our patients and their family members are coping with, as we are all also coping with in this shared traumatic experience that this pandemic is bringing into our work, into our homes, into our daily lives. And so let's address some common misperceptions with communication. The first, my intent is how I am perceived. I have the normal and valid perspective. It's somebody else who has the problem. That most people feel the same way that I do. That my way or perspective is the best way to handle it or manage a situation. And the way that people act is how they need to be treated by others. And we know that right now that out of fear and anxiety sometimes comes anger. And we know right now you are managing situations that unfortunately sometimes come to life through anger. And so we need to focus on our empathy and our perspective-taking skills to de-escalate and maintain compassion. And that there's an ideal communication style. The reality is we all bring our own unique communication gifts to the table. And Christine Barath wrote a brilliant book on mastering civility, where, much like that earlier statistic that I shared around perceptions and intent, 95% of us consider ourselves self-aware. The only challenge is really about 15% of us are truly self-aware. So we have an 80% gap. And we have to remember that many degrees of self-awareness have to do with context. Because this quote brings a lot to life. We don't see things as they are. We see things as we are. And so that heightens the need in this crisis for the foundational practice of empathy, which in its simplest form and definition is the ability to understand and share the feelings of another. Despite all the disruption that we're experiencing, there is a norm to our work in healthcare every day. There is a norm to our clinical training, our background, our experience, regardless of where we sit in the continuum of care. The role of a patient, especially a patient in a pandemic, is a totally different viewpoint. And so the 5 skills that we're going to be working on in the subsequent videos come out of our model for CARES, which is highly reliable patient experience training. And I'm going to give you a preview of all of those skills to support you in this managing COVID-19. We begin with confidence. How do we project ours and build up the patient and family members' confidence? How do we anticipate 3 distinct needs? Emotional, clinical, and safety. How do we engage in respectful communication with our verbal and nonverbal body language? What are practices we can employ to engage the patient and family member in care and process despite all of our restrictions right now? And then how do we own that lasting impression where we either say thank you and express our gratitude or ensure a safe transition to the next caregiver or step? And so as we dive into CARES more, this is not scripting, it's more improvisational skills to help you respond in the moment. And it all backs up to this question: what if we could still be our authentic self during COVID-19? What if we could still be true to our goals and ambitions as caregivers and not get so tied down with all of the fears and anxieties and let our gifts shine through? The next question is, you care for many patients every day. How do you want your patients to remember you? I paused intentionally after asking that question because it's a question that only you can answer for yourself and contribute to for your department. The reality is, patients and family members will, especially now, remember us for the rest of their lives. We have to manage more and more digitally with different video conferencing tools and FaceTime and video chats. Really think about, how do you authentically want to be known, and how are you showing up every day so that intent is consistently received? Because we can quickly lose our way when we forget our why. And CARES is about you delivering that experience. And in the next 2 videos, we're going to dive into each one of these skills because your work matters and we want to support you when you need it in this time. Thank you.